Number two, and probably just as important to look for in choosing a facelift surgeon, is results. So in the era of social media, it's a lot easier to get results out there. And so there's no excuse for a facelift surgeon not to have a lot of easy and accessible results. And I think in assessing someone's results, there's two main things to look for. One, are you seeing honest pictures? I'm pretty obsessive about my photography. I actually even take my pictures myself because I can't quite give it up yet. But for medical photography, it's different. You're not taking those with an iPhone. I use a DSLR. It is consistent lighting, consistent angles, and it is taking those photos at different portions of recovery so you can objectively look at results, changes, all of those sort of things without having other lighting and filtering and makeup come into play. It's important to be able to see photos like that. I acknowledge that with more destination patients, it becomes difficult because I don't get to see them back past a week. And so I may not be able to get those nice long-term follow-up results at 3 months and 6 months against my blank wall consistently. But at least in the immediate post-operative period, I try and get them that first week. And yes, as a plastic surgeon, there's nothing I love more than having a patient send me a picture when they're out and about or at a party of them all cute and dressed up and made up. And yes, we love to post those because it does show how things actually look. But just know that photos taken by patients with iPhones are maybe a little bit of cheating because they soften the edges, they run all sorts of algorithms, and obviously different lighting and different makeup. So look for good, consistent photos available. The other thing in photos I think to be aware of is that you want to see patients that look like you. You want to see a wide variety of patients. And I sometimes get criticized because I have facelift patients that are in their 80s, from 50s to 80s. I have facelift patients of all weights and all skin qualities. And I think it's really important to post a wide variety of patients. Not everyone is the same. If somebody is only posting thin white women that are 40 to 50 years old, that maybe don't really need much done to begin with, that maybe isn't the best indication of abilities unless that fits what you're looking for. And so I think it's important to see somebody that, can handle difficult necks and heavier skin and different skin type individuals because it shows quality and depth as a surgeon.